So talking about mandible bone, right? So the mandible is derived from Greek word mentor, so which means to masticate, right? And Latin word mandibula means lower jaw. So next here, features and attachment. Mandible has a body and two rami. First of all, see here, mandible has a body and two rami. One body and two rami here. Now coming body. It is shaped like horseshoe and has two surfaces, external and internal, and two borders, upper and lower. So surface, right here, surface of body, external surface, and here internal surface, right? So feature of external surface here, symphysis menti, first features. Second features, mental protuberance. And third features, mental tubercle. And fourth feature, mental foramen, right? So next features, incisive fossa. And sixth number features, oblique line. Okay, so next here, so only total see here 6 features. So first of all, see here, symphysis menti. It is a faint ridge on the upper part of middle, indicate the fusion of two half of mandible. So next features, mental protuberance, this one. It is a triangular area in the lower part of midline. The upper angle of triangles marks the lower end of symphysis menti. And next features, mental tubercle. So mental tubercles, the lower angle of triangular mental protuberance are marked by tubercle called mental tubercles, right? Next features, mental foramen. It is located below the second premolar or junction between two premolar teeth. Mental nerve and vessel passes through it. So next features, incisive fossa. It is a shallow fossa below the incisive teeth. Mentalis and orbicularis originate from this fossa. Next features, oblique lines. It is continuation of anterior border of ramus on the external surface of body. It is a faint ridge. It runs downward and forward to reach mental tubercle, right? So next here, see here, internal surface. Internal surface, first of all, see here main features. First point, mylohyoid line. Second point, submandibular fossa. Third features, sublingual fossa. And fourth features, genial tubercle, this one, right? So first of all, talking about mylohyoid line. It is an oblique ridge. It extends downward and forward from behind the third molar tooth to midline near the lower border between digastric fossa. Mylohyoid muscle is attached to it. Next features submandibular fossa. This one, it is present below the posterior part of mylohyoid length, right? And it loaded submandibular salivary glands, facial artery, and submandibular lymph node. So next feature is sublingual fossa. It is an area above the anterior part of mylohyoid length. It loaded the sublingual salivary gland. Next feature, genial tubercle. This one, the genial tubercle. So genial tubercle is a irregular elevation on either side of midline, just above the anterior end of mylohyoid lines. Upper genial tubercle provide attachment to genioglossus muscles, where lower genial tubercle gives origin to geniohyoid muscle. So next discuss about border, right? So basically here border, upper border and lower border. So upper border, see here, it is a also called alveolar part of mandible. It is hollowed out by 16 socket for the root of permanent teeth. So next feature, the socket vary in size and depth. The socket may be single, subdivided by the septa according to teeth which they contain here. The lower borders, it is also called the base of mandibles. So digestive fossa here is a depression at its anterior and on each sides of the midlines. It receives attachment of anterior belly of digastric muscles. Next point, investing layer of deep cervical fascia is attached to whole length of base, right? Next attachment platysma is inserted to lower border near the outer surface. Okay, so this one, the ramus of mandible. Ramus of mandible has two surfaces, lateral and medial, and four border, upper, lower, anterior and posterior, and two process, coronoid and condylar. So see here lateral surface. Lateral surface, a small posterior area, is related to parotid glands. Next point, remaining major area provide attachment to masseter muscle. So see here medial surface, this one, the here medial surface. So here mandibular foramen and canal, and here lingula, here mylohyoid grooves, here medial surface of here medial surface of ramus between mylohyoid grooves and angle of mandible is marked by ridge. This area so here mandibular foramen and canal. Okay, so mandibular foramen is located a little above the center of medial surface. It leads into mandibular canals which curve downward and forward into the body to open on the external surface at the mental foramen. Inferior alveolar nerve and vessels enter the mandibular canal through the mandibular foramen. Okay, so next feature, lingula, here pointed area. So this is lingula. It is a tongue-shaped projections near the anterior margin of mandibular foramen. So sphenomandibular ligament is attached to the lingula. Next features, mylohyoid grooves. It begins at the lower end of mandibular foramen behind the lingula and continues downward and forward to reach the inner surface of body. Mylohyoid nerve and vessels occupy the mylohyoid grooves. So here border, next here upper border, lower border, anterior border and a posterior border. So see here upper border. First of all, see here upper border. It is a thin. It's for mandibular notch or incisure. And it is a masseteric nerves and vessels cross the and here masseteric nerve and vessels cross the mandibular notch. And next here lower borders. It is backward continuation of the base of mandibles. It meets with the posterior border of ramus to form angle of mandible. Next feature, next border, anterior border. Anterior border, it is continuation above with the coronoid process, this one, and below with alveolar border of body. Temporalis muscle is inserted on this border and adjoining medial surface. Next border, here posterior border. It is continuations above with the condylar process. It meets with the lower border to form angle of mandible, and it is related to parotid gland. Next features process. Here process of mandible. See here first process coronoid process, second process condylar process. So coronoid process, right, see here coronoid process, it is a triangular upward projection from the anterosuperiorly part of ramus. Its anterior border is continuous with the anterior border of ramus and its posterior border bound the mandibular notch. Temporalis muscles gets insert on the medial surface, apex and margin of coronoid process, this area. Condylar process, right here, condylar process, it is an upward projections from the posterior superiorly part of ramus. It consists of an upper part, here head, and lower part, here neck. So head of condylar process, it is side to side expanded part of condylar process. It articulates with the temporal bone to form temporomandibular joint. So other name TMJ joint, TM joint. Next here neck of the condylar process, it is constructed part below the head. It provides attachment to capsule in its upper parts. Lateral ligament of temporomandibular joint is attached to its lateral part, and here pterygoid fovea is a depression on its anterior aspect. Lateral pterygoid muscle is inserted on the pterygoid fovea. Next here medially the neck is related to articulotemporal nerve above and maxillary artery below. So see here ossification of mandible. Mandible is a intramembranous as well as endochondral in origins. The membranes involved is the mesenchymal sheath on the lateral aspect of both Meckel's cartilage. Here, this point, Meckel's cartilage. A center appears on the east side in these sheaths during 7th week of intrauterine life. So next point, cartilage contribute to the mandible. Here, anterior end of Meckel's cartilage. These are invaded by the bone from parent center at 10th week of intrauterine life. So next point, coronoid cartilage. This one, the coronoid cartilage. These appear at 10th week of intrauterine life and disappear before birth. So next here, condylar cartilage. These appear at 10th week of intrauterine life and persist till 3rd descent. So cartilaginous nodules here, this point, cartilaginous nodules, one or two of these nodules appear on the east side of symphysis menti at about 10th week of intrauterine life. These ossify to form mental ossicles at about the 7th month of intrauterine life and fuse with the body at the age of 1 year. See here, during age change, right? So in the children's, the body of mandible is more like a cell having socket for both decidua and permanent teeth. The angle of mandibles measure about 140 degree. Coronoid process is above the level of condylar process, and mandibular canal and mental foramens are close to the lower border of body. So in adult, the alveolar and subalveolar part of the body of equal depth. The angle of mandible measure about 110 degree and a condylar process project above the level of coronoid process. Mandibular canal runs parallel to the mylohyoid lines. The mental foramen is situated midway between upper and lower border of body, and in the old age, here old age mandible. Loss of teeth is a usual features. Alveolar part is absorbed. Angle of mandibles measure about 140 degree. Neck of mandible is bent backwards, making the level of coronoid process higher than the condylar process. Mandibular canal and mental foramen are close to the upper border of body.